Hi again, everyone. Vidya, thanks for joining me here. Why don't we start by, I just want to you to talk for a minute about your own personal background and how your history and how you, in 1 minute or less, and how you ended up at Teladoc.
Who am I, huh?
Yes, who are you?
Well, I always start by saying I'm a mother of 2 wonderful children, a wife, a sister, and a daughter like everybody else. But so I serve as Teladoc Health's Chief Medical Officer today, and my journey is one of going from clinical medicine to the world of healthcare innovation when we, in fact, didn't have a footprint around innovation within healthcare. So I've spent the better part of the last 22 years in organizations like the Blues, Deloitte, United Healthcare, Johnson & Johnson, Amazon, a startup, and then worked with companies like ZS in some capacity, and then here I am. So,
we've seen digital health explode, obviously, during the pandemic. Can you talk a little about that and what's changed and how it's changed our lives and the industry?
There's no doubt that it's exploded. I was actually at another event a couple days ago, and this was like the main focus of the conversation. I won't say that the number of companies in digital tech have exploded since the pandemic, but I think their value and relevance has come to be better understood. So we're no different, right? So from a virtual healthcare standpoint, we're seeing greater and greater receptivity and acceptance and trust on the part of both patients and providers with respect to digital technology, and particularly for us, what matters is the virtual care. We are seeing continued enrollment in our virtual primary program, our chronic conditions. But interestingly, 60 to 65% of patients that enroll in our primary care program tell us they've never had a PCP before. So those are not great statistics, but what it tells us is that there is a gap. There's a huge gap to be closed. We're increasingly diagnosing patients with hypertension and diabetes for the first time. But the good news, again, is that we're not only able to treat them, but we're able to connect them with resources that can help them take care of themselves over a longitudinal period of time. So it's not like a one and done, it's more of a longitudinal, holistic approach to care.
Are there lessons learned from the pandemic about things we should do differently or change in the future?
I would say that, I don't know that we all saw the potential for technology and virtual care during the pandemic. So perhaps we could have placed, more closer attention to what this could be post-pandemic. I think we were all caught up in that. Second is, I don't know that we've, paid close attention to improving customer experience, consumer experience, and so on and so forth. So we're very focused on that, very focused on putting data to use to really drive outcomes and engagement. So just because the technology is there, it doesn't mean people will come. You still have to do your job and help people understand the relevance of what you're doing.
What can you talk about GLP-1s and the relationship with what you call whole person care and what that is?
So you asked about strategy and what it did to us. So we went very quickly post-pandemic, evolving from just being an urgent care to provide everything from primary care focused on prevention to chronic care, mental health care, and we're also in inpatient hospital settings, right? The approach we take clinically to patient care is what we call whole person care. It's a simple concept that our health and disease is influenced by multiple factors, some physical, some mental, some social, and some beyond that. So there's a lot of context. And when you care for somebody, it's very important to understand all of those dimensions. So when we provide care, not just through our assets, but through the data, we make sure that we're understanding who we are serving, what exactly the person's needs are, and what the outcomes should be for that person. So in the context of your question about GLP-1, and I know tomorrow there's a session around obesity management. I can't wait to listen to that. But so think about it, even with weight. So there's weight, and then there's all else that's cardiometabolic health. So weight is just one metric, right? But what we're really after is that overall cardiometabolic health, and what that takes us to is this world of helping people, setting them up for success to manage the lifestyle attributes like nutrition, activity, sleep, and stress. And so GLP-1s and other medications become adjuncts to strong focus on lifestyle, because you want them to be able to maintain these for a long period of time. These drugs are, they come with their own side effects and risks, and current thinking is that they have to be taken indefinitely. So we work with patients to understand where they are with all of the social drivers of health, with the root causes of health, helping them manage that, and then looking at these drugs as adjuncts.
Should we be worried about overprescribing?
We should be. I think without taking that longitudinal and a personalized approach to care, any medication for that matter, I think there is always that risk, but we take that responsibility very seriously. I mean, we're very heavily focused on patient safety as well.
Let's talk for a moment about regulatory challenges that telehealth is facing. Is the FDA your friend? What are some of the challenges you see ahead?
So, I think there are policies and regulations that come at the federal level, but it's also important for a company like Teladoc, which is in all 50 states, that we have to understand and comply with state-by-state regulations. So it actually gets very challenging and complex. And then while you're doing that, you can't lose sight of the fact that you're providing care as well in a very personalized manner. So combine what you have to do at the government, federal and state level with the fact that here you have a person who has multiple needs, and then you have to think through the operational challenges, you have to look at safety, you have to look at quality. So yes, I mean, I think we take regulations seriously. I do think we need them. They have a place, and we have to solve for it in a manner that will work for us.
Can you talk about a little more about the regulatory specific challenges you're seeing?
When you say challenges, so there have been numerous, right? So if you're alluding to the current DEA rule, if that's, it's as of today, I think they have extended what's been in place. And so here's how I would respond, right? So there is, much like our overall strategy, there's the clinical appropriateness, safety, quality, and like I said, for us, having to navigate state-by-state specific. So the agency rule is one, but there are state-specific regulations and rules that we have to follow. We have to look at operational challenges of doing this one at a time, state by state. We have to think of platform implications, right? But at the end of the day, say what is safe. That said, we were right there lobbying and providing comments and working with multiple stakeholders and coalitions to provide that input, and so we hope to be part of that.
You touched on patient safety, but could you talk a little more about that and how you deal with it, especially on a state-by-state basis?
So we have a very robust infrastructure around quality and patient safety. And remember, there is no playbook out there for how to do this in the virtual world. So we generously adopted from the brick and mortar, but I would also say we went ahead and enhanced it, because in the virtual world, things get a little bit more challenging. We have the first ever, the Agency for Healthcare Research and Quality Certified Patient Safety Organization at Teladoc. So again, when it comes to a regulation, whether it comes to treatment of weight and cardiometabolic health or all else, we look at it from the patient safety team is very active, and not just in saying how we should be treating people, but also in understanding what's working, what's not working. And sometimes we do find things that need correction and quickly fix them. So.
And let me ask a final question, and that is Teladoc. Is there anything that this audience should know about Teladoc that they might not know?
Oh, great question, and I love it. Thank you for that. I would say that I'm just astonished every single time that I'm in social environments, not these, our professional gatherings, social environments, how many people think of virtual care as just being the answer for urgent care. So Teladoc and what we do is not just urgent care. We provide the gamut of services across the care spectrum. Think of us as any other clinical care provider. So we take that responsibility seriously, hugely leverage data science, and analytics to drive patient engagement and outcomes. So we're bigger, broader, and better than just urgent care.
Great. That should do it. Thank you so much.
Thank you, Rick.
Vidya, I've really enjoyed this. Thanks.
My pleasure. Thank you so much.